Hey, Eastern Oregon. I'm Brent, and we're here with you today. Sure thankful that you guys have joined us. This is the bi-weekly CHD update, and I want to encourage you to, for those of you that are watching live on Facebook, take advantage of submitting some of those questions. Some of them are already coming in, and I really appreciate that. Like always, we're joined with Carrie, and Carrie, appreciate you taking the time to jump in with us. And man, our COVID numbers have just like really changed in the last few weeks. And I know you guys are probably, you probably are busy just like you were when we had the first outbreak, you know. I don't know. I guess the question that is on everyone's mind is, you know, where are this increased cases coming from? I don't know. Talk about that. Talk about that, where we are and how we're getting here.
Yeah, sure. Thanks so much for the opportunity to come on here and talk with the community about COVID-19 and what's going on in Union County. Certainly since the last time we talked, we've definitely seen an increase in cases. I think the last time we spoke really wasn't unexpected that once we moved into the fall, we would see an increase in cases. I think there are a number of factors which we've talked about before that influence that, but now we're actually seeing that increase that we expected. So, over the last week or so, last week we had 58 cases, and I look at the weeks from Sunday through Saturday because I'm tracking them related to the school metrics. So there were 58 cases last week. Before that, 46, and then before that, 28. So that was the first time that we had seen those numbers in quite some time. So again, the numbers are increased like we expected. I think, one of the things that I really do want our community to know is that one of what we're seeing now are a lot of cases of what we call sporadic cases. And so sporadic cases are cases that we can't necessarily track back to another source, an outbreak, a common location. We just, we in public health, the way we do our work is we do an investigation, which I've talked about here before. And through that process, we ask a lot of questions to really try and identify where somebody was during the time that they would have contracted the virus, so we can really try and identify the source and then use that information to identify people that are at risk and stop the spread. And right now, what we're finding is that even through those interviews, and, we work really hard to try and get information to try and, we want to trace it back to a source. That's the best case scenario, because then we know where it's starting, where it's coming from, where people are getting it, and we can be more effective in stopping the spread. And right now, we're just finding that people don't really know where they've gotten it. They're not all connected to each other. So again, we have what's called sporadic cases. So we do have a few, clusters of cases. We do have some cases that are connected to each other, but I really do want folks in the community to know that it is really what we would consider community spread, and that they're not all interconnected, and that it is, in various parts of the community.
So I'm sure that you hear a lot, and I mean, there's a lot of buzz. Part of it is associated with the election. I mean, it's just everything is just this gigantic mess right now. And there are some people that, I mean, I don't know. Why don't you tell me some of the things that you, I don't know, maybe some of the outlandish things that you hear. What are some of the conspiracy theories that you hear? And I don't know, maybe say a word or two about some of those things that you're hearing.
Well, I definitely hear all kinds of things. And of course, when you ask me directly for me to comment on them, I blank. Yeah. I think, I have to be honest, that in public health, like right now, we're still doing what we've been doing all along, which is really trying to prevent people from getting the virus, really trying to prevent people from becoming ill who may be at risk for more serious case of the disease. And then, again, going back to the beginning, really trying to limit the impact on our hospital system. So we have hospital capacity for people that do need that level of care. And so I think, sometimes I feel like, I hear things in the community, but, our heads are really down and focused on doing the day-to-day work that we do in public health, which is really trying to get good information about how to prevent the spread of the virus, and then doing the investigations and contact tracing, which is really one of the primary tools that we have to get people to stay home who are ill, and then identify people that are at risk so they're not out in the community potentially impacting those around them. So I'll probably think of something later tonight that I could have commented on, but I'm blanking right now. Sorry.
No, it's okay. I didn't prep you for that question. And I guess part of it is that, families get together, and there's just a lot of information, however that's based, there's a lot of stuff going around. Everybody has an opinion, and they share those things with each other, which they certainly have the right to, and so on and so forth. But I remind people who are sometimes talk about a vast conspiracy or whatever the case might be, that you guys are just doing your job. You have a task. You're responsible as the CHD to help and maintain the care locally of our community. And, you're just doing your thing. You're consistent. I have to say that. You guys have been doing the same thing. It's the same messaging. It's just exactly what it has been for the last 9 months now, I guess.
Yeah, some days I wake up and I'm like, I'm going to go say the same thing to Brent that I said to him last week and the week before, and that I've been saying to him for months on end. And, the reality is that we really are trying to prevent death. And I come back to that every day. We're really trying to make sure that the worst outcome doesn't happen. And I feel like we've been really fortunate in Union County. The number of deaths of people that have died with COVID-19 is very low, given the number of cases that we've had in our community. That's a huge win for Union County. Our hospital capacity, both in Union County and in Region 9, which is what we look at for our response work, we've been able to maintain our hospital capacity. We've been very, very fortunate. But, I feel like I still see what's going on in other parts of the country. And I still feel like I was talking to somebody earlier today, and one of the things that's really challenging about COVID-19 is that some people can have it and have zero symptoms. Some people can have it and have a very, very serious case of the illness and be very, very sick to the point where they're hospitalized, or, again, that it could contribute to their death. And so, it's serious. It's serious to me, and it's serious to us. And we really are just trying to get people good information about how they can protect themselves and the people that they love. And again, if they have the virus or they are at risk for having the virus, give them that information so they can keep themselves safe, know what to do if they become ill, and also protect their loved ones and the community, and keep our hospital capacity intact. So if somebody in their family does get severely ill, that the hospital can care for them.
Yeah. So somebody on Facebook said, she seems to be hedging. Where really are the cases coming from? And maybe you can explain a little bit about the information that you can share or that you can't share when you talk about cases.
Yeah, sure. So, obviously, if you had the virus, I would not want to go out and give your private information to people. And we live in a small community. So the reality is I could give you information about one case and you could figure out who it is. So, again, I am trying to be cautious with the information while also sharing information. So the one resource and piece of information that I do want the community to be aware of is the weekly report that the Oregon Health Authority puts out. And honestly, it has really pretty comprehensive information about what's going on. So I believe the weekly report is where you can find data on zip codes. There's publicly shared information about where the cases zip codes are. There's information in there about workplace outbreaks, congregate care setting outbreaks, every single case that is happens in a school, whether it's among a staff person or an employee, is included in that weekly report. So, you can go on there and you can see. So there are Union County outbreaks listed on that. There will be, that report comes out every Wednesday. I refreshed before this meeting before this interview, and I didn't see the updated one come out, but it will come out at some point today. And I just really want to refer people to that information, because that's the information that can be shared publicly, and it will be the most up-to-date and accurate. So like I've shared in our media releases this week, we have been working on a long-term care facility outbreak. So some of the cases that you've seen over the last week or so have been associated with that. I think that what we have seen in Union County and beyond is that when we have an outbreak in a congregate setting, a place where people are living together, working together, in close contact with each other, when you get a case in that setting, then it's very likely that you will end up having more cases, because that information, that setting, it's really hard to contain it because people are interacting with each other in close contact. So, like I said, there's definitely been a few cases, but I mean, what I'm trying to communicate here is that this is not isolated to one location. It's not isolated to one town. It's not isolated to one workplace. It's not isolated to one facility. It's out there. And that's really what I'm trying to communicate.
Yeah. And I'm going to ask you that question a little bit as a devil's advocate, but I understand, and so none of this is surprising to us. I mean, this is all information that we knew. What you just said is, so any business that is optional has reduced the amount of population or the amount of contact between them and their employees and so on and so forth. But clearly there are some essential things that are going to continue on. And when there is a case among, it's not hard to look at the largest employers in the Valley and figure out that there's possibly, if there is a case there that happens, there's probably going to be more than one case, So, and then given flu season, given everything that we know, none of this is a surprise. And I really appreciate, our hospital has not even been close to, all of the information that I know has not even it hasn't been close to being overwhelmed. I would guess, I don't think it's even ever been at 50% capacity of what it can handle. I don't know those numbers at all, but I know that there is my hunch is there's a tremendous amount of capacity left in our system. And again, hospital capacity is not based upon, we learned this earlier, it's not based upon necessarily our particular hospital. It's based upon a group of hospitals that handle, and a region of hospitals that handle an area. So yeah, we're really fortunate. We're not having those issues that people that you hear about in Arizona, and some of those hot spots where people are overwhelmed. That's just not us right now.
Yeah, we've been really fortunate. And again, I refer people to the Oregon Health Authority website because there's a whole page on hospital capacity, and it provides information on the regional capacity. And Region 9 is the region that we're located in. There's information about the types of cases that are in hospitals. So, again, all that information is available to the public. I think that the one thing that I would also emphasize is that, we are seeing, I know in the information that's come out in the last few weeks, that some of our metro area hospitals have potentially had some capacity issues. And I think the one thing that we have to try and balance here is that by the time we've hit capacity, by the time we're having an issue, it's really hard to step that back. And so that's why right now is the time for us to really hunker down. And I know I kind of feel silly saying that, but it's really time for us to take action today. So 2 weeks from now, we're not seeing as much spread in the community and not having those severe cases that would impact the hospital capacity. So we don't want to get to the point where it's too late to have an influence on what happens there. So right now we're good, but given what's going on both in our state and nationally, we still need to be cautious.
Yeah. Well, thank you. And I'm getting a little bit of pushback on Facebook because I asked you to comment on conspiracy theories. But the point here is that you and I need to continue to have real life conversations about COVID, and we have to recognize the conversations that are going on outside. And I appreciate you, the professionalism, the way. Yeah, I mean, you have a family, you have kids, you're dealing with schooling, and let's talk to that. Let's talk about that. So how has the increased cases affected the local schools?
Yeah, so I think one of the things that I want to make sure folks in our community know is that the freeze that Governor Brown has put into effect starting today doesn't really impact the way that we look at schools, either providing on-site instruction or transitioning to comprehensive distance learning. We have a completely separate set of school metrics that we're using for that, and it's not a part of the freeze at all. So right now, even though we have had an increase in cases in our community, the schools that were providing on-site instruction to students in Union County, for the most part, have continued to provide in-person instruction. And so, once students are on-site in person doing their learning, we're really going to focus on looking at what's happening in the school and the impacts to the school. And so even though we have a lot of cases in the community, we've had a huge increase in cases in the community, if those cases aren't impacting the school environment directly, then the schools really do have the ability to continue to stay open. So the schools are really the ones that are responsible for making those decisions, and they consult with public health. And so we're working with them on a regular basis to give them information, answer questions, help them navigate the scenarios that come forward. And if it gets to a point where, there's significant transmission in the school environment, the cases that we're seeing are, severely impacting one school, then, we may be having a conversation with them about transitioning students back to distance learning. And, so far, one of the things that we kind of have going for us is that schools have put a large number of mitigations in place in the school environment. So, they are physically distancing to the greatest extent possible. They are cleaning very, very, very thoroughly. They are having people stay home if they're ill. They're doing great jobs with, quarantining folks that could have been contacts to confirm cases. They're wearing face coverings. They're doing, they put all these protections in place in that environment. And so even if they have an employee or a student that tests positive and that was in the school environment, because they put all of those protections in place, the likelihood that somebody else there gets it is very low. They're reducing the risk that once it gets into the school setting, it will transmit. And this is like a classic example of how public health really does its work. So we're looking at creating an environment where the transmission reduces, where it makes it less likely that once somebody is in that environment that they will become ill or be at risk of being exposed. So because schools have done such a good job of implementing those mitigations in the Ready Schools Safe Learners guidance document that they're working from, they haven't been significantly impacted. And I think, the governor has talked a lot about social gatherings. And I think that because social gatherings are typically places where those mitigations may not be as strictly enforced, that is where the spread is happening. If I have a bunch of people come over to my house and we're just hanging out in my living room and we're sitting close to each other, we're not wearing face coverings, we're just hanging out in close contact, then the chances are that that spread is going to occur. And so what we are seeing, and this is playing out across the state and the nation, is that environments like schools and workplaces where we put mitigations in place, the transmission is much less likely than in those social gatherings where we don't have those strict environmental setups that stop the spread, if that makes sense.
Yeah, it does totally. Thank you. So one of the questions that we've seen before, talk about the recovery stats, and that's the number of people that are recovered. And we haven't talked about this for a while, but it seems like that's a stat that's difficult to keep up with, or it's not reported. I don't know. Talk about that a little bit, if you would.
Yeah, so early on in the response to the pandemic, the Oregon Health Authority would call people after, a certain amount of time to see whether or not they fit the definition of recovery. And I honestly don't even know what definition they were using. I think part of the challenge has been that we are still learning about COVID-19 still. I mean, we still don't know everything about the virus. And so we don't know what it looks like for somebody to be fully recovered. We find that some people, and it's kind of like I was saying earlier, this virus is a little bit complicated in that it's hard to come up with a pattern for how it impacts people. So, some people never have a symptom. They test positive, they had no clue they had the virus. Some people could get the virus and they could be hospitalized for weeks on end. They can have coughs that linger for indefinite periods of time. And so, as we continue to learn to understand it, what it means to be recovered is still being defined. And I've seen multiple definitions of what would be considered recovery. So right now, I don't have the definition memorized, but the investigative guidelines that we use do have a definition of recovery. And I believe that if you have passed 60 days and you haven't passed away, basically, I mean, then we would consider you to be in that definition of recovery. But I think one of the things that is hard about this one for me is that I feel like putting somebody in that box of being recovered doesn't necessarily give people the information that they want, which is they want to know if people are better. They want to know if people are cured. They want to know if people, have come out of it and they're never going to be impacted by it again, or they don't have any sign. And it's just not, I don't know that it really gives you helpful information. So I don't know. That's kind of my take on it. And I know it's not the answer that people really want to hear, but sometimes I don't have an answer that fits what people are looking for.
Well, and I guess I would, if I was in charge of keeping track of this virus, the number of people, it would be kind of like, well, yeah, if they've had it and they didn't die, the number of cases that they've had, and the number of people that, and you subtract the number of people that died, and after a while, that's the number of people that have recovered. So it kind of, I'm not sure why it's important, but I understand that it's pretty difficult to gauge. So one of the questions that we're getting that we want to talk about, hey, the cases have gone up. Are we doing more testing? Is that why the cases have gone up?
Yeah, so I would say yes and maybe no. So we are definitely doing more testing in Union County. And part of that is because there are more people that are showing symptoms of COVID-19 and they're going into their primary care provider or to the urgent care clinic and getting tested. And CHD over the last month has also increased the testing that we're providing. So we're now doing additional for a while we were didn't have as much virus activity, so the needs were getting met by people going to their primary care provider or urgent care. But now we're also offering testing primarily to people that have symptoms. So again, there are people that are ill that are wanting to know if this is what's causing their illness, and then contacts to people that have been confirmed as having the illness. So, again, we're not testing a large number of asymptomatic people. So the reality is that if you look at our test positivity rate, it's still quite high. And so even though we're testing more people, we're identifying more people that have the illness. So I guess doing more testing does identify more people that have the illness, but the benefit to doing that is that if we know that's what you have, then we can give you good instructions for how you limit spreading it to other people. So I hope that answers the question.
No, I think it does. And I mean, I know we're still not, I mean, I know this from my own experience. I have a friend who's not feeling well, had a cold or flu, went into the doctor because he wanted to be tested, and he wasn't tested. They did not test him because he didn't have the right, he didn't still meet the criteria to be tested. And so I guess the point of that is that, yes, we are testing more people, but we're just not needlessly testing folks. It's still not on demand unless they've been at risk in some way. I mean, certainly if they have the correct symptoms, and we've gone over those a couple of different times, or if they've been in contact, if they are been in contact with known positive cases, then that's the criteria essentially that people are being tested. Yeah. Okay.
Yeah, we're still really focusing on people that have a risk for getting for testing positive, right? They either have symptoms or they've been in close contact to a confirmed case. And again, this is a tool that we're using to contain the virus, slow the spread of the virus. And what we know is that if I were to go, I have no symptoms. I have not been in contact with anybody who has COVID-19 to my knowledge. And so if I were to go out and get tested today, it would give me the information that I'm negative today, right now. And then I could say, oh, I'm good, and then go hang out with somebody tonight that unknowingly has it, and I could be infected tomorrow. And so really, again, the test is a tool for identifying people's or diagnosing their illness if they are ill. And then again, identifying people that really truly are at risk for having contracting the virus and using it as a tool to help get them quarantined or isolated if needed.
Yeah. And this is a way more intelligent. I mean, the fact is we're like 9 months into this or longer, right? And so we're smarter at knowing how to at least track it. And we have more information all the time. And who knows, hopefully there is a vaccine around the corner that will be effective and widespread and all of the stuff, because I think everybody is anxious to move on and be done with this, get on to another part of our lives. So,
yeah.
Well, anything else that we need to hit on today, Carrie?
Oh gosh, every time you ask that question, I kind of blank too. I do want people to know that CHD is offering testing, and that if you do meet that criteria, if you have symptoms and or you think you've been in contact with somebody who has COVID-19, we can help get you signed up for testing. We're having people call our COVID number, and I can get that before we sign off. Basically leaving a message, and then we'll have somebody call you and screen you and see if you fit the criteria. And if you do, we will schedule you for an appointment. We're not just doing drop-ins. We actually want people to come at a certain time, and that just helps us manage the workflow. So if people call 541-624-2179 and leave a message, I also want to point out that on our Facebook page, we have information about the right timeline for getting tested. So we really recommend that people wait 5 days after that contact to get tested. And if you think about it, it takes a little bit of time for the virus to build up in your system, so it will show up on a test. And we really don't want people coming in like the day of the contact and then testing negative and feeling like they don't have it, where there's actually a chance that they could have it, but it's just not developed to a point where it's showing up in their system. So we really encourage people that aren't symptomatic but were contacts to a confirmed case to wait a little bit before getting tested. And we'll walk you through that if you fit that category, and call us and leave a message. And like I said, if you're ill and you have a primary care provider, I mean, again, I would recommend that you work with them so they can manage your care. That's the point of having a primary care provider. But, for folks that may not have a primary care provider or may not be able to get in, or for whatever reason, CHD is just another option for testing.
So, and it's just like it always was, where if you wouldn't have gone to the doctor because you were ill a year ago with whatever symptoms you're experiencing, then it doesn't necessarily mean that you should go now, unless you are specifically, having some of those symptoms that are uniquely COVID related or have been in contact with someone.
Yeah, I mean, we would definitely recommend that you don't go to your doctor unless you would normally go to your doctor. Absolutely. And, usually if we contact you and let you know that you've been a contact to a confirmed case, then again, that would make sense. And we would be able to set you up for testing if we identified you as a contact to a confirmed case. It's not an exact science. You could learn that you're a contact prior to being contacted by public health. It's possible, but yes, we would definitely just try and limit it to those folks at this time.
And unless the information has changed, the most reliable test that we have still that's common is they put a swab up your nose to the back of your throat, and that's where they're looking for the COVID, and they put that on the swab and they test that. But COVID can be in your body and not be at that location for a little bit. And so that's what you're relating is that, for our means of testing, for the test to be positive, it has to be at the location. I mean, that's just what we have. That's the means that we have right now of testing. And so then that's kind of the 5-day thing.
And it's really viral load. So and this is a medical term, but it's basically just like the amount of virus you have in your system, right? So if I contact you right now and there's not going to be enough virus in my system for the test to detect it, I'm not a medical provider, so I don't know all the ins and outs of that, but it's the viral load. And yes, right now there's a lot of different methods for testing for COVID-19. Right now, the most reliable is the nasopharyngeal swab, which is the most commonly used test, but there are definitely other tests that are being developed. I even heard something on the news about in-home testing that we might be able to do at some point. So, right now, at CHD, we're primarily doing those tests, that the nasopharyngeal tests that do get sent away to the lab. They're not rapid testing. Again, most of the people that we will be testing are people that are already isolating and quarantining. So waiting a few days to get the result doesn't really, it doesn't change their timeline. It doesn't change the isolation or quarantine period. So, but like I said, there's more types of tests available, and we'll see them roll out, I'm sure, over the next few months and years.
And all of that is a good reason why, when we're with people outside of our family, outside of the people that we're normally with, there's just some wisdom in keeping our distance from them, clearly wearing a mask when we're around them, not being, in physical contact with them. Just the things that we all know. We're all aggravated by it. We're all tired of it, but those are still the things that are the best help for us.
Yeah, I mean, I've talked about them every time we've come on here, but the physically distancing really can make a difference. And, I know that a lot of people are looking forward to seeing their family next week because of Thanksgiving. And I know that it's probably not everybody's going to alter their plans. I understand that. And so, I think what I would really encourage people to do and like to ask people to do is really think about what modifications can you make to make it safer, right?
Good.
And it was kind of like when I was talking about the school environment. It's like, how can you change the environment just a little bit so you reduce your risk? I mean, and that's, can you maybe this year make the size of the gathering a little bit smaller? Or when you're with each other, can you sit further apart? I just, again, really thinking through like, maybe you don't fully change your plans, but how can you reduce the risk when you do come together? And it's about making sure that our loved ones are safe and making sure that they're around for the next holiday.
Yeah. And all of that just makes sense. I mean, that's not hard for us to do, is to just give a little thought behind how can we do it in a safer manner. Yeah, I mean, I'm having conversations that with my own family that I never thought I would have. We're changing our plans, we're altering our plans. And it's kind of funny, even at the office here, we all work in very isolated spaces, so we're not at risk of infecting each other, but we are still, people are staying home when they have a cold, when, a year ago that probably wouldn't have held them up. And so, these are just kind of the things that we can do in this climate to be as safe as we can. Is, if you have a cold, even a simple cold, and you can work remotely from home, then we're going to figure out a way of doing that. And that just makes sense in this climate.
Absolutely.
Yep. All right, Carrie. Well, hey, thanks so much for jumping in with us today. And thanks, Eastern Oregon, for being here. And we'll